Wear the Gown, brought to you by CHI St. Vincent.
Now, this next edition of what we call Gowns is going to seem to run counter to our overall goal of preventing crisis by taking better care of yourself. But watch closely. There's a lesson that can be learned from this medical mystery. Here's Craig O'Neill.
This story involves the CHI Emergency Cath Lab. And here's the doc involved with a preview of what you're about to see.
This is very unusual. Very unusual.
See that woman in red at the desk? That's Nicole Kaemmerling. Fit, healthy, smiling, enthusiastic. No visual clues as to what recently happened to her.
While I was in the shower, all of a sudden I started having like this crushing chest pain.
She and her husband, a doctor, knew the symptoms. He drove Nicole right to the hospital. And all the way there, she was skeptical.
I kept thinking these are heart attack symptoms, but I don't have any risk factors for a heart attack.
On the ER gurney under the light in physical distress, she was still cool until the defibrillator pads came out.
That scared me more than anything. I think that's when it really hit home that, you know, this could be serious.
It was serious. It was definitely a heart attack.
She developed a sudden clot in one of the main arteries that supplies the heart.
Interventional cardiologist Aravind Rao normally would have put in a stent, but
Her arteries were so small.
they promptly corrected her problem because time is muscle.
We have a St. Vincent's goal of taking care of every heart attack patient in less than 60 minutes.
Oh, I feel so much better.
Now on blood thinners, she's rapidly improving.
Her heart function on her last test was back to normal.
But her case remains a mystery.
I mean, if somebody would have said at 51 you're going to have a heart attack, I would have laughed at them.
He's asymptomatic. He could do his stress test.
Taking a look back, both doctor and patient agree that while her dedication to good health couldn't prevent her attack, her personal education saved her time that saved her life.
And I think that's the biggest factor is people just wait.
Education is key, it's very important.
Lack of knowledge and disbelief can definitely be your enemy.